Dr. Reingold, I'd like to start by talking about the different responses that various countries have taken to the coronavirus. Can you kind of compare and contrast Italy versus South Korea versus China, and who you think has kind of done the best to stop the spread of the coronavirus?
Well, I think if people are probably pretty familiar with the fact that in China, that China did start responding. They did so in an incredibly forceful manner, using the military, using the police, and really not only cordoning off the entire area and not letting anyone enter or leave, but when they did identify infected individuals, really forcefully preventing them from exposing others. I think the evidence is that in both places like Korea, South Korea, and Singapore and Hong Kong, that people did successfully also at least slow the spread and potentially bring things under control without being as forceful. But they did it in large part through extensive testing of individuals. And then when they found people positive, not letting them expose other people. So that approach, while not as draconian as the approach in China, certainly was relied on a system and resources devoted to the problem. So those appear to have worked. Italy and perhaps behind it some other countries in Europe like France, I think have clearly have yet to succeed in bringing their outbreaks under control and seem to still be growing in size. And so, whatever they've been doing there, and I think it's been incremental, and particularly in terms of the forcefulness with which it's been brought to bear, they still have more to do if they truly want to bring things under control. So I think the lessons for the United States, again, we've been quite late in the United States responding to this. I think most people in public health believe that we should have been acting more vigorously much earlier. That would have been easier if we had access to widespread testing. And at least based on my discussions with friends who were on the front lines of clinical medicine, even as of the end of last week here in Northern California. It's still not easy to get a test for a patient who you'd like to make the diagnosis in. So whatever the messages are from on high, that anyone who needs a test can get a test, that's really not true. Frankly, certainly here, and from discussions with friends in Boston and elsewhere. So we've been hampered in our response by not having testing available. And I would say generally not being completely persuaded early on that this was something that required a forceful response.
What about the Bay Area specifically? I know that California ordered a statewide shelter in place, and the Bay Area was ahead of the state in that manner. Was it soon enough and aggressive enough to flatten the curve in order to allow our hospitals to have the adequate resources to respond to the number of cases that we might see here?
Well, as I said, I have friends working in emergency rooms and intensive care units in the Bay Area, and they're pretty busy. They're struggling with the whole question of having to put on personal protective equipment to do appropriate procedures on very sick patients. So they're very worried that in the next couple of weeks they could run out of sufficient equipment, that the numbers of cases will go up and that they'll really be struggling. I think at the moment they're managing, but there is a concern that our system could be, at least for some period of time, overwhelmed here in the Bay Area. So I think that it's a real concern, and at least for the coming few weeks, I think it's an open question.
Is there anything more that you think that public officials should be doing in order to ensure that we don't see a surge of cases in the next few weeks that overwhelms hospitals?
First of all, I think we are going to see an increase in cases in the next at least week or two. So I think in terms of whatever was done in our 6 counties, whatever the governor did, those are still relatively recent from an epidemiologic point of view in terms of the incubation period of this virus and the number of people who are probably infected in the community. So I don't necessarily expect to see an impact of those measures for at least a couple more weeks. I could be wrong, but I think it'd be incredibly optimistic to think we'll see a flattening of the curve, as you called it, in the next week or 10 days. So if we're lucky, if all of these measures do have an effect, then I would be hopeful that certainly by the middle to end of April, we would see a noticeable effect.
And do you have an argument to make to people who aren't following these shelter in place orders, who aren't taking this seriously? Why is this so important to follow?
So, I think that young, healthy people tend to believe they're immune to severe health events. And so that not wanting to disrupt their normal lives and activities is understandable. And they recognize that, as is true for many diseases, the frail elderly or people with underlying illnesses like heart disease and lung disease are at greater risk of getting very sick and dying of things like the coronavirus. But I guess the two messages I would give are that, first of all, we do tragically have severe cases and even occasional deaths in young people. So they do happen. It's true they happen at a lower frequency, but it's not that they never happen. So I think there is still some risk to young people that they can get very sick. Secondly, we don't know whether even a milder or moderate case of this illness could produce long-term consequences in terms of lung function, for example. That remains to be seen. And then I would just make the argument that if we want to protect those among us who are frail and elderly, our grandparents, our parents, our coworkers, that we can potentially help with that by following these rules, regulations, recommendations, because we put them at risk if we transmit to them, and we're all part of the same society. So that would be the other argument for why we like even people who don't perceive themselves to be at risk to go along with these measures and take them seriously.
And I think at this point, everyone really wants to know, when will this be over? And some people have said perhaps, this will no longer be necessary by summer. Others have said we may need some measures of social distancing for the next 12 months. I mean, do you see an end to this, or when do you see that happening?
So I think no one can really predict what's going to happen with this virus. So people who extrapolate from flu and say warm weather will make this disappear, that might happen. There are reasons to think there could be an effect of warmer temperatures. There are reasons to think there might not be. I don't know the answer to that question, and I would argue nobody really knows. We'll have to wait and see. Um, but even if it diminishes during the summer, that doesn't tell us what will happen next fall or next winter when cold weather returns. So I think we just don't have the answer to those questions at the moment. I think the challenge is um, when can we get back to letting people go to their place of work, have in-person classes, do recreational activities in a safe way, and is that this summer, or is it late spring? Is it in the fall? We just don't know. And I think one of the problems is we're still figuring out how we're going to do that and what types of information we'll need to guide those decisions. So if people would say, well, officials and experts are waffling on that and not giving us clear guidance, I would say that that's a correct statement because we just don't know.